Language disorders can pose unique challenges to communication. In this discussion, we'll unravel the complexities of aphasia and apraxia, two conditions often confused due to their overlapping symptoms. We will explore the differences, causes, symptoms, diagnosis, treatment, and impact of aphasia versus apraxia. Aphasia versus apraxia. What is the difference? What is aphasia? Aphasia is a language disorder that can impact speaking, understanding, reading, and writing. It comes in various forms, with Broca's aphasia affecting speech, and Wernicke's aphasia affecting understanding and speech. Aphasia symptoms vary by type. Speaking: difficulty forming sentences, finding words, or speaking fluently. Understanding: trouble comprehending spoken or written language. Writing: challenges in writing legibly and conveying ideas. Vocabulary: reduced word recall and use of vague language. Numbers: difficulty with arithmetic and managing finances. Aphasia is primarily caused by brain damage, with common causes including stroke, when a blood clot or vessel rupture deprives brain cells of oxygen. Head injury, traumatic brain injuries, or TBI, from accidents or falls. Brain tumor, pressure on language areas due to benign or malignant tumors. Neurological conditions, progressive brain degeneration, as in Alzheimer's. Brain infections, damage from infections like encephalitis or meningitis. What is apraxia of speech? Apraxia of speech is a disorder affecting speech coordination due to brain motor issues. Unlike aphasia, it doesn't impact language comprehension. People with apraxia struggle with pronunciation, resulting in inconsistent speech, especially with complex phrases. They may be aware of errors, but find them challenging to correct. Apraxia symptoms include difficulty with articulation, leading to imprecise pronunciation. Inconsistent errors in speech, with words pronounced correctly at times and incorrectly at others. Challenges with longer phrases, affecting clarity in extended speech. Groping movements to find the right articulatory position. Slow and effortful speech, with difficulty initiating and transitioning sounds. Awareness of errors in pronunciation. Additional difficulties may involve prosody, affecting speech rhythm and intonation. Sequencing, leading to jumbled speech. Motor planning, resulting in imprecise or inconsistent speech. Causes of apraxia. Apraxia of speech can result from brain damage. This can occur due to stroke, head trauma, or brain tumors, affecting speech motor control areas. Degenerative diseases. Conditions like primary progressive apraxia of speech, or PPAOS, involve gradual brain structure deterioration. Neurodevelopmental factors. In some childhood cases, disrupted motor speech skill development is linked to apraxia. Idiopathic apraxia. Rarely, apraxia appears without an apparent cause, leading to idiopathic cases. Age groups impacted by aphasia or apraxia of speech. Aphasia and apraxia can affect individuals of all ages, although their prevalence and causes may vary across different age groups. Here's a breakdown of who can be affected by both aphasia and apraxia. Aphasia primarily impacts adults and seniors, often linked to conditions like stroke or age-related neurological diseases, while children may also experience it due to brain injuries or developmental disorders. In contrast, apraxia mainly affects children, primarily childhood apraxia of speech, or CAS, with neurologically based causes, but it can also occur in adults due to brain injuries, strokes, or neurological conditions affecting motor control centers. Aphasia and apraxia are complex language disorders that can significantly impact an individual's communication ability. While they are not typically considered curable, they are treatable conditions. Early diagnosis, speech therapy, and ongoing support are vital in improving communication outcomes and enhancing the quality of life for those affected by these disorders. Understanding the differences between aphasia and apraxia and the available treatment options is essential for providing the best possible care and support to individuals and their families. Connect with us today to learn more about speech therapy options for aphasia, apraxia of speech, and language disorders.